You may have seen President Obama this morning on NBC's Today Show citing the Heritage Foundation's research in an attempt to sell his health care package as a middle-of-the-road centrist approach.
When you actually look at the bill itself, it incorporates all sorts of Republican ideas. I mean, a lot of commentators have said, this is sort of similar to the bill that Mitt Romney, the Republican governor and now presidential candidate, passed in Massachusetts. A lot of the ideas in terms of the exchange, just being able to pool and improve the purchasing power of individuals in the insurance market, that originated from the Heritage Foundation.
We take great exception to this misuse of our work and his abuse of our name. This is the latest act in a campaign to sell this big government program as a moderate law that incorporates conservative ideas. Americans should not be fooled. Let me be very clear. We oppose this new law because it's a radical new intrusion into the daily lives of all Americans and a massive takeover of 1/6 of the U.S. economy. The president's health care plan raises premiums, raises taxes, and increases costs while lowering quality and cutting Medicare and expanding Medicaid. Furthermore, our research has shown that the Obama approach is financially unsustainable and that it will ultimately lead to health care rationing, a lower quality of care, and a greater degree of dependence on government. We deplore those outcomes and are committed to making the intellectual case for this law's repeal. Let me be very clear. These are not ideas Heritage has ever or would ever support. What part of that does President Obama not understand? The president has made a habit of using conservative talking points when trying to sell a liberal ideology because he knows that we are a center-right country, that we reject his agenda when it's articulated honestly. His supporters have even tried to pin the blame of the potentially unconstitutional individual mandate on us. These are not conservative ideas. Had President Obama limited his bill to centrist elements based on conservative principles, he would have won wide bipartisan support for effective reform, both within Congress and among the American people. He would have won it, too, at a fraction of the cost of this intolerable, huge, and intrusive legislation. He would not now be facing popular rejection by the American people, and he would not need to misrepresent Heritage policies and positions in this attempt to give his radical health plan an air of respectability. This is not common politics, it's common sense. To see all of our healthcare research and to get the accurate story, I urge you to go to heritage.org. Thank you.